Hello guys, just want to make an update with the letter that was published by the Royal College regarding the MRCS OSCE exam. The Royal College have published a letter informing about the proposed module of the MRCS OSCE exam for Part B in next of October in 2020 regarding the changes and the challenges posed by the COVID-19. The Royal College have proposed to the GMC to change the format of the MRCS OSCE exam to ensure that the exam can be delivered safely and in a social distanced way, as they are fearing for another wave of COVID-19, and also as they want to offer credibility for the course. This letter is an showing that there is an intention of the Royal College to deliver the exam with no cancellation, and they want to make some compromises in the exam to be delivered in a way that would be safe and will not hurting and with no changes in the credibility of the exam. And the GMC, which is the institution that is responsible for reviewing these exams, that's why the GMC is currently reviewing this submission, which means that this proposal is not definitive and just temporary under reviewing of the GMC. First, the proposed changes in the format of the exam is reducing the number of procedure skills from 2 to 1 and reducing the number of history taking stations from 2 to 1, reducing the number of the anatomy station from 3 to 2, reducing the number of the pathology from 2 to 1. So the whole number of stations is reduced from 17 to 13 in a way and trial to decrease the number and the amount of contact between the actors and to keep the social distancing in the exam. Also, they want to change the method of examination that was delivered to decrease or prevent the patient and actor contact to allow the social distancing concept to take place and to focus on identification and discussion of the signs and symptoms described. That's why in our course we have to give more attention and more focus in the theoretical and the information regarding the diagnosis and the investigations and the management plan rather than the act of the examination and the pointing out of the signs during examination and the interpretation of the examination, but rather focus and increase the concentration on the information regarding the diagnosis and the investigation. Also, regarding the procedure skills, they want to deliver it without an actor, which would be done remotely if necessary, which is either in a maquette or a mannequin, or with no actor in the field. That's also, we have to point out that in the absence of the actor or the mannequin, you have to stick to the same principles and the same rules of the procedure skills regarding permission to examine and the washing your hands and introduce yourself to keep the way and the same system of procedure skills application in the exam for you to get marked, and also to focus in the discussion regarding the procedure skills. The last but not least about the changes that we want to make in the module of the MRCS OSCE is the introduction of a single pass mark for the entire circuit rather than separate pass mark for knowledge and skill component, which means that first they were giving a pass mark for each of station in the procedure skill and each of the station of the clinical examination and the history. Now they will evaluate it as a whole, which is give us less chance of variability, but it will, according to the exam, it will allow you to pass or fail. The plan for the 4 surgical royal colleges to run the examination socially distanced in person. That's why if this is not possible, if there is a problem and there's rising of another wave of COVID-19, they will plan it to do it by video conferencing, either online, which this proposal was refused by and was sent an email by many candidates of the developing countries because of the unstable internet connection, and this will lead to lack of fairness in the exam between different candidates around the world. But they have the right to do so. That's why they are giving a short notice of this restriction before the test by at least 1 month. That's why they want the candidates not to book their travel tickets except after receiving the admission letters from the Royal College of Surgeons. In the next paragraph, the Royal College is saying if this exam was delivered remotely, the candidates will need a computer or laptop with a camera and with good internet connectivity. And as I said, this was refused and objected by many of the candidates, which in developing countries have unstable internet connection. Also, this detailed equipment along with an overview how online delivery will work. This will be provided later on if this kind of exam is decided to be delivered. They will send and frequently asked questions, a document of all the questions that you want to ask about the exam if they decided to make it either social distance exam or an online exam. That's why they are asking all the candidates just to check their mails over and over in a regular interval to know these changes for the Royal College and for the exam was made or not. To sum up for this letter gives an idea that the Royal College want to go for the exam, want to do it, but from the other point of view, they will do it in the UK first, and this proposal is not a permanent proposal. That's why we have to stay tuned for the next letter. Will be this proposal will be either it will be permanent or there will be another changes made for the MRCS OSCE exam. Thank you all, and waiting for all your comments.